Ouch! Does surgery hurt? Hi, I'm Dr. Raghu Athré with Athre Facial Plastics in Houston, Texas. This is probably one of the most common questions that we get when we discuss facelift surgery. Does it hurt? So, first of all, to anybody who wants to know the answer to this question, the answer will be here in this video, but you don't have to take my word for it. Please check out all of the patient journeys that we have posted on our YouTube channel, because this is a question that I ask each and every one of my patients, and you can hear their own perspective of the same question. So during the surgery, if the patient selects local anesthesia with oral sedation, this is what I basically tell them. I am going to give you enough medication to make you feel like you've had maybe 4 or 5 margaritas. Then I'm going to numb you up. I think a good way to think about this is kind of like a root canal. That's a common thing that probably most people have had the experience of going through. And it's very similar to that in that the dentist normally says, hey, listen, I'm going to numb you up. You'll feel a little stick. And after that, everything goes numb. So this is pretty much exactly the same type of feeling that patients undergoing a facelift feel. So I give them medication to reduce their anxiety, also reduce the amount of pain, and then I numb them up. Patients will normally say that the numbing is probably about a 3 to 4 out of 10 over the course of the numbing. Once I've numbed them up, they really don't feel anything at all anymore. The main things that patients feel during surgery that gives them discomfort is sometimes surgery is a long day and they can get a relatively tight neck or tight back just from being in the same position for extended periods of time. One of the things that we try to do to combat this is take little breaks during surgery so that the patient can move, and we call it a wiggle break. After surgery, patients are discharged home with their facelift dressing. My average patient probably takes about half of a pain pill the first night of surgery. When I question patients the next morning after surgery, almost everyone says it doesn't hurt, it just feels very tight. The dressing is a little bit compressive to minimize the bruising and swelling, and I think this is where they're getting that feeling of the tight feeling. We take the dressings off on post-operative day number 1. Once the dressings are off, almost every patient says their pain and discomfort is pretty much gone. Probably over 70% of my patients don't even take any pain pills during their post-operative course. The standard protocol, I think, for most patients is to take a half pain pill the first night of surgery, a half pain pill the day 1 after surgery in the night to help them sleep, and after that, most patients are pretty much taking extra strength Tylenol, and after about day 4 to 5, they're not taking any medications at all other than prescribed medications such as antibiotics or vitamins to minimize bruising and swelling. So I think that this should give the viewer here a very clear understanding of what that feels like after surgery. Again, as I said before, you don't have to take my word for it. Go ahead and check out all the other stories here, and you will see the kind of repetitive theme that almost every one of these patients states. So facelift surgery isn't really painful. Now, this should prompt a question, hey, Dr. Athré, why isn't facelift surgery painful? There's actually a very good reason to this. So as we're elevating the skin from the underlying tissues, little tiny nerve ending rootlets actually are being trimmed as we lift that flap up. It's just inadvertent. When that happens, some of these areas are a little numb after surgery. So one of the side effects of a facelift is you can have some patchy numbness in some of these areas that can last for about 3 to 4 months. This is one of the primary reasons that facelift surgery, if done well, that little caveat needs to be put in there, should not be painful after surgery. I hope this really helped. If you found this content useful, educational, made you think, please give us the like or hit the subscribe button. If it prompted questions, please contact us via email, some phone, or DM, or leave us a comment in the comments down below, and we will try to get back to you as soon as possible. Thank you so much for watching our videos. We love producing them, and we love hearing from you. Dr. Raghu Athré, Athre Facial Plastics, Houston, Texas.